We have another case study. Professor Michael Tiran, can you help me to tell me something about this condition?
Yeah, this patient presented to our clinic with very, very severe psoriasis covering the whole body. Very thick flakiness. The patient was very, very ill actually.
Yes.
He mentioned that he had fever and he had very flaky condition. This condition is very severe and needs to be monitored closely.
Could you please tell us a little bit about the psoriasis for this one?
Yes, psoriasis is a genetic condition. It normally stays dormant in your system until it gets triggered. Obviously, once it's triggered, it flares up, just like this man. This condition has been triggered and it's flared up now.
Yeah, but the triggers for this condition is?
There are many triggers. We believe stress is involved in it, but also is he's a heavy drinker.
Yes,
and
heavy
also,
drink, yeah.
he
Is
drinks
that
a lot of
alcohol,
alcohol.
isn't it?
Yeah. And our research shows that alcohol plays a big role with psoriasis, and there are a lot of international papers that have been published to show that alcohol affects psoriasis.
So I understand now that alcohol will affect the psoriasis, but how about the smoking?
Yes, smoking also has a big impact on psoriasis because nicotine has been shown to affect psoriasis. And again, there are many reports and there are many publications that have been done to demonstrate the effects of both alcohol and nicotine on psoriasis.
But for this patient, before come to clinic, which treatments he used before?
He's tried many different treatments. He's tried topical treatments, he's used steroids, he'll use calcipotriol, he's used over-the-counter steroid products, and at the same time, he's used a lot of other medications like systemic medications, we call it, like he's used methotrexate, he's used cyclosporin, which are immunosuppressants, and more recently, he even used biologic. He mentioned to us that he did get some improvement, but his condition came back again. In conjunction with that, we gave him some topicals to use, some ointment to use, and also some bioherbal tablets that we have at the clinic that we gave him. And after a few months, his skin is improved enormously. He's very happy about the result he's got. We are very happy too. But what's important here, Casey, is it's important that we empower the patient. We tell the patient what they need to know to improve their skin condition. Because we don't want to see the patient every 2 or 3 weeks. We want to teach them what triggers they need to avoid, get them to understand there are causative factors that are involved, and they must address these triggers, otherwise they get results, but they come back very quickly.
But how long the results will come for this man?
He's had psoriasis for many, many years.
Yes.
And so he's gone through the whole process. He understands psoriasis, I think, quite well, that it comes and goes. Yeah. And there are triggers that need to be addressed. So in our treatment protocol for him, we identified a number of triggers that flare up his skin. Like I mentioned, alcohol is one of them, and smoking is another one. So it was crucial that he reduced his alcohol intake and the amount of cigarettes he has a day.
It's hard.
Yes, it's very difficult. But in addition to that, he was very stressed. He has a lot of stress from work and from family matters. So we had to work with him to give him a management program to help him. Whenever there's a lot of stress involved with the patient, it's important that the patient do some form of exercise because exercise metabolizes stress hormones. But more importantly, exercise also produces a lot of anti-inflammatories which support your immune system. So we got him on a good plan. We got him to do something that he enjoys doing. And I also told him it's important that he watches some comedies before he goes to bed at night.
That's great.
Because when you watch something that makes you laugh and makes you happy, you get very, like you feel great.
He will release the stress, isn't
it? Exactly.
I think for this case, is a lot of people, especially the men in Vietnam, they will be interested about this case. Thank you for your advice, Professor.
I appreciate being here. Thank you.